Hi, my name is Mazda Farshad. I'm an endoscopic spine surgeon in Switzerland and the founder of the Endospine Academy and the ORX. When you perform spinal endoscopy, there are two factors that determine complexity of the procedures. The technical complexity is defined by the challenges in the approach mainly, while the morphological complexity usually depends on the pathoanatomy, namely the disorder you're treating. So far, there is no real categorization combining these main factors to create a scale of complexity. This is the overview of the most commonly performed endoscopic procedures with the nomenclature according to the AO consensus group. The abbreviations are not easy to understand, and this overview helps you to remember them. You see the most challenging approaches in the first row, followed by the approaches with moderate complexity in the middle row, and the easiest approaches in the last row. Then there is certainly also a complexity associated with the morphology or pathoanatomy that you are treating. Take, for example, a fresh soft disc at L5-S1 compared to a calcified disc in the thoracic region. Clear to every surgeon that these are different animals. We have asked 112 endoscopic surgeons from 27 countries to classify both the technical complexity and the most common morphologies to create a consensus for a complexity scale. This scale is the product of the consensus of the spinal endoscopic community. On the vertical axis, you'll find the complexity associated with the approach. On the horizontal axis, the complexity associated with the morphology. Let's take a calcified disc that you want to address with a transforaminal thoracic decompression. According to our scale, this would be a type 3B procedure, certainly a case with a high complexity. Let's compare it to a soft disc herniation at L5-S1 that you want to address with the interlaminar endoscopic discectomy. This is a type 1A case, an easy case in other words. For the first time, complexities of endoscopic procedures can now be quantified on a scale that represents the consensus of over 100 international endoscopic spine surgeons. This scale should help you better understand the complexity of your next case. It will also help the beginner to proceed in a step-by-step fashion and to continue to develop endoscopic research. The scale is already being used by a majority of endoscopic spine surgeons internationally and is endorsed by the Endospine Academy. Thank you very much for your attention.